Good morning, everyone. Thank you for having me here at the SMA Assembly this year. My name is Supriya Dhuarali. I'm a second-year medical student at Nova Southeastern University, Dr. Kiran C. Patel College of Osteopathic Medicine. And today I will be talking about the relationship between anxiety and dementia. Essentially, we're looking at whether or not anxiety has any contribution to a later onset of dementia. So here, I'll just start off a little bit talking about dementia. As we know, it's a group of cognitive symptoms that often start as an individual starts to age. We start seeing problems like memory defects, language impairment, difficulties with problem solving, just making simple decisions, things that really affect these individuals' everyday functioning. There are many different forms of dementia. For the purposes of this literature review, we stuck to the umbrella term dementia, so we could just see how the correlation exists between anxiety and just the overall term of dementia. So with a lot of new research going into this topic, we're seeing that there are many risk factors that are contributing to the development of dementia with aging, but obviously there is much to learn. So here we'll just discuss the relationship between anxiety and dementia. So for the literature review, we looked at articles between the years 2000 to 2022, and they were all peer-reviewed primary journal articles and meta-analyses that were published between those years. So we've highlighted 5 studies here. Obviously, there's a lot more that's going in the paper, but these are just studies that really highlight the relationship. So the first study is by Burton et al., looking at 400 cases with dementia in populations greater than 65 years old, matched to 1,353 controls. They were matched by age and gender. And essentially what they found was that a history of anxiety diagnosis was associated with a future dementia diagnosis. The second study is also similar, done by Santa Barbara et al. They looked at 4,803 random community citizens greater than or equal to 55 years old. And again, they were seeing that clinically significant anxiety did increase the risk of dementia 3 times. And this was a follow-up study, so they followed up the participants for 4.5 years. So this really gives us a better view of like the development from anxiety going on to developing dementia. The third one is Petkus et al., looking at Swedish twins, age 50 years old without dementia. So essentially what they did was they completed an assessment of baseline anxiety in 1984, and they followed these twins for 28 years. And they used state trait personality inventory for baseline anxiety. And they did the mini mental assessment exam to assess for dementia. And essentially what they were seeing was that the anxiety score that was higher at baseline and also at all time points in the twin who had the higher scores ultimately ended up developing dementia later in their life. And they also saw that the association was much higher in dizygotic twins compared to monozygotic. So I find the study really interesting personally, just because it gives us an overview of the genetic factors that play into the development of dementia. The fourth study is by Kasem et al. And this one looked at a secondary data analysis of 1,452 community dwelling women greater than or equal to 65 years old. And what they saw was, again, that mild anxiety symptoms at the baseline assessment was associated with an increase in dementia diagnosis over 5 years. Finally, we have a study from Krell, Roche et al., looking at subjects that were aged greater than or equal to 70. 842 had no cognitive impairment. The other 180 had mild cognitive impairment. And this was a cross-sectional done where a panel of physicians and neuropsychologists reviewed the results of participants who underwent a mini mental status exam. and basically consulted on whether or not they would diagnose the patient with any cognitive impairment. And what they found was that deposition of amyloid beta plaques in the mild cognitive impairment group was associated with a history of depression, but not anxiety. So obviously not all studies point to the correlation that we're looking for. There's also studies saying that there isn't necessarily a relationship between changes induced in dementia correlated to anxiety. So as you can see in the diagram, the illustration we have here, the point we're trying to make is that, and what we've learned from our literature review is that changes in brain activity, so things like increase in cortisol levels, increase in inflammation, chronic stress, as well as genetic factors are contributing to some kind of change in the brain activity and function, leading to symptoms of dementia. And we're hoping that learning more about this correlation and the risk factors will help us alleviate whatever is contributing to the development of anxiety and future development of dementia. And it is our hope that with new treatments, the current SSRIs that are being used, we can definitely look more into how they're contributing to the pathology and whether they're actually helping or exacerbating the risk factor. And hopefully we'll find something to go off of after doing more research. And if you have any questions, I'd be happy to take them. Thank you for listening. Yes.
You brought up a good point. I was wondering if any of these patients in any of the cases were already on anti-anxiety medications.
They were not. They were not. So they had a prior history. According to the paper, there was no indication of them being on medication for anxiety. So this was just a prior diagnosis at some point. Maybe they did, but the paper did not say anything about it for any of these. So I'm not entirely sure. And I have the references QR code, so you can pull up all the papers also if you're interested. But yeah, as far as I know, they did not. Anything else?